Your Excellencies, Nana Chair, distinguished guests, good afternoon. Today I rise to present the state of the Ghana Red Cross Society. Yet beyond the institution itself, I stand to present the state of vulnerability, resilience, and humanity in Ghana today. Because the true measure of any Red Cross society is not found in its structures, its offices, or even its plans, but in how effectively it responds when systems are strained, when communities are overwhelmed, and when human dignity is at risk. Your Excellencies, the humanitarian landscape, both globally and within our own borders, has fundamentally changed. It is no longer defined by isolated emergencies that come and go. Rather, it is shaped by continuous and overlapping pressures. Across the world, the International Federation of Red Cross estimates that hundreds of millions of people require humanitarian assistance each year, driven by climate shocks, public health emergencies, and socio-economic vulnerabilities. The World Health Organization continues to warn that epidemic-prone diseases are increasing in frequency, particularly in low and middle-income countries. Ghana reflects this globally in a localized but deeply significant way. We are not a conflict zone, yet we are increasingly a multi-risk environment. Recurrent flooding, expanding urban vulnerability, persistent sanitation challenges, and emerging infectious diseases are placing sustained pressure on our system. With approximately 23% of our population still practicing open defecation, exposure to waterborne diseases remain a constant threat. Maternal mortality at 263 per 100,000 live births highlights persistent gaps in healthcare delivery. And despite steady progress, Ghana achieves only about 2/3 of its expected health outcomes relative to its economic capacity. This is not a narrative of failure, it is a signal, a clear and urgent signal that institutions like the Ghana Red Cross Society are not optional but essential. In responding to this evolving reality, our work has moved beyond emergency reaction to building resilience, preparedness, and long-term recovery. Our operational footprints across the country reflects this shift. Your Excellencies, the Apiati explosion occurred. It was not merely a disaster, it was a national trauma. Entire households were wiped out in seconds. Families lost not only their homes, but their sense of stability and belonging. In response, the Ghana Red Cross Society moved beyond traditional model of relief distribution. We provided integrated emergency assistance, shelter, food, and essential supplies, while simultaneously delivering psychosocial support to address the invisible wounds of trauma. We supported family tracing systems to reconnect separated loved ones. And importantly, we remained in the initial response, recognizing the true humanitarian action. Similarly, the Akosombo spillage demonstrated how climate risk can rapidly evolve into human crisis. Thousands of individuals were displaced and livelihoods disrupted. Our response unfolded in phases: immediate relief through emergency shelter and safe water provision, to stabilization through hygiene protection and camp coordination. In the face of recent cholera outbreaks with over 1,700 suspected cases across more than 30 districts, we extended our help to the needy. When Mpox cases began to emerge, our approach reflected a strategic shift. Rather than waiting for escalation, we activated preparedness mechanism. We developed a national contingency framework, trained volunteers in community-based resilience, and strengthened communication systems to counter misinformation. This marked a transition from reactive humanitarianism to anticipatory action, an approach that will define the future of effective response. Beyond emergency response, our programs continue to address structural vulnerabilities. The Green Woman Project in the Upper West exemplifies this commitment. By combining economic empowerment, environmental sustainability, and social protection, the initiative supports women not as beneficiaries of charity, but as agents of transformation within their communities. The Ghana Red Cross Society, in collaboration with the International Federation of Red Cross and Red Crescent Societies and key national partners, is actually currently implementing a strategic portfolio of projects between 2023, that started from 2023, and is continuing to 2027, aimed at strengthening community resilience, improving public health systems, enhancing disaster preparedness, and expanding access to safe water and hygiene services across Ghana. A key intervention is the locally led adaptation project, running from December 2025 to November 2026 in the Upper Denkyira West municipality of the Central Region, with a budget of over 100,000 CHF. This initiative is designed to empower communities to identify and prioritize their own climate risks through participatory processes. Following an enhanced vulnerability and capacity assessment conducted in 6 months in 6 communities, the project supports locally driven adaptation planning and ensures that community priorities are integrated in municipal development planning frameworks. In the health sector, the society is implementing the Resilience and Empowerment African Community Health Project, what we call the REACH project, a 2-year initiative valued at 1 million euros and funded by the Italian Cooperation Agency through IFRC. Implemented in collaboration with the Ghana Health Service across 4 regions, REACH aims to strengthen community-based health systems, improves access to quality primary health care, and enhance preparedness to public health emergencies in undeserved areas. Stakeholder engagement with the Ministry of Health, the Ghana Health Service, has been completed, with a co-creation workshop scheduled in mid-May 2026. Under disaster preparedness, the simplified early action protocol for flooding, running from January 2026 to December 2027, with a budget of over 200,000 CHF, focuses on anticipatory action which forecast-based triggers. The project aims to reduce the impact of flooding by operationalizing early warning signs, pre-positioning essential relief items such as hygiene kits and PPEs. In the area of urban water, sanitation and hygiene, Your Excellency, the Urban Wash Pilot Project, which started in January 2023 and will end in June 2024, implemented in the Asante Mampong and Greater Kumasi with funding of over 300,000 euros from the Netherlands Red Cross through IFRC, has made significant impact. The project has connected over 1,300 households to pipe-borne water, reached over 45,621 individuals with hygiene and behavioral change messaging, and trained 60 volunteers and water user associations. A memorandum of understanding has been signed between the Ghana Water Company, and a behavioral change and community engagement manual has been developed, providing a scalable model for urban wash delivery in Ghana. Your Excellencies, distinguished guests, while we reflect on these achievements, we must also confront our challenges with honesty and purpose. Across the globe, humanitarian financing is under strain. Declining funding, donor fatigue, and competing global priorities are widening the gap between needs and resources. For Ghana, this translates into continued reliance on external funding, which, while valuable, introduces structural vulnerability. We are encouraged by the support of government, yet we respectfully call for the support to be accelerated, institutionalized, and aligned with national development framework. Investing in Ghana Red Cross is not funding, an organization. It is strengthening national resilience. Equally urgent is the need to review and pass the new Ghana Red Cross Act. A modern humanitarian institution requires a legal framework that reflects contemporary realities. Despite significant progress, repeated parliamentary transitions have delayed this process. We respectfully urge that this be prioritized as it will strengthen our mandate, accountability, and effectiveness. Your Excellencies, we must also address the gradual erosion of our auxiliary role to government. The Ghana Red Cross Society is not simply another NGO. It is a legally recognized partner to public institutions in humanitarian field. Reduced representations on key platforms and limited involvement in national planning processes have weakened coordination and efficiency. We therefore call for a restoration of structured collaboration and a full recognition of this role in both policy and practice. At the same time, limited domestic resource mobilization remains a pressing concern. Humanitarian needs are local, yet funding remains largely external. We must build a national culture of giving, one that recognizes humanitarian investment as a driver of social stability and economic growth. We also face challenges in media engagement, where the cost of visibility can divert resources from service delivery. We appeal to the media to view humanitarian communication as a public good, as essential service that informs, educates, and saves lives. Internally, we acknowledge a period of institutional difficulty in the past. However, over the past 4 years, we have restored stability, strengthened governance, and renewed our commitment to transparency. We are not where we were. We are stronger, but continuous support remains essential. Rising operational costs driven by inflation and logistical pressures are further stretching limited resources. These challenges are significant, but they are not unsurmountable. They are in fact a call to action. Your Excellencies, this brings me to the defining vision for the future of humanitarian service in Ghana: the establishment of a 100-bed Ghana Red Cross International Humanitarian Hospital. This is not an optional ambition, it is a necessary evolution. Our experiences from the Apiati to Akosombo, from cholera to Mpox, have demonstrated the limitations of temporary solutions. Emergencies overwhelm our existing facilities. Access to specialized care is often delayed, and gaps persist between community-level response and facility-based treatment. This hospital will be completely different. It will be grounded in the principles of humanity, impartiality, and neutrality. No one will be turned away because of inability to pay. Care will be delivered based on need with dignity and compassion. Functionally, the hospital will serve as a national emergency and disaster response hub, capable of managing mass casualty incidents and providing surge capacity during crisis. It will operate as an epidemic preparedness and response center with isolation units and integration into national surveillance system. It will provide accessible, quality health care to vulnerable populations, reducing inequalities in access. And it will serve as a training and capacity development hub, strengthening the next generation of responders. The initiative aligns with Ghana's commitment to universal health coverage, national disaster preparedness priorities, and global Red Cross and Red Crescent strategies. We therefore call for strategic partners from government, development partners, the private sector, and philanthropists. This is not a Red Cross project alone. It is a national mission. Your Excellencies, distinguished guests, the vision before us is clear. The needs are growing, the challenges are evolving, but so too must our response. Ghana Red Cross Society stands ready, not only to respond to today's emergencies, but to shape a more resilient and humane future for our nation. Let us together build that future. Let us invest in humanity. Let us strengthen our systems, empower our people and commit to a Ghana where dignity is provided, even in the most difficult moments. Because the true test of any nation is not how it performs in times of comfort, but how it responds in moments of crisis. Before I conclude, permit me, Your Excellencies, to recognize the backbone of our work, our over 72,000 volunteers across the country. These are ordinary Ghanaians who choose every day to do extraordinary things, to respond first, to serve selflessly, and to stand in solidarity with those in need. From remote communities to urban centers, they carry the emblem of humanity with courage, discipline, and compassion. To each and every one of them, we say thank you. You are the strength of the Ghana Red Cross Society and the living embodiment of humanity in action. And this brings us to the heart of this year's theme, United in Humanity. Your Excellencies, it is a responsibility. It calls for us to look beyond institutions, beyond sectors, and beyond differences, and to recognize a simple truth, that in moments of crisis, we are bound not only by titles or status, but our shared humanity. It means that the suffering of one community must concern us all. It means that the response to disaster, disease, vulnerability cannot be fragmented. It must be collective. The government, private sector, development partners, the media, and every citizen all have a role to play. For the Ghana Red Cross Society, being united in humanity means standing as a bridge between communities and systems, between needs and response, between vulnerability and hope. It means ensuring that no one is left behind, no matter where they are, who they are, or what they can afford. Today, I invite all of us to renew this commitment. Let us act together. Let us invest together. Let us respond together. Because when we are truly united in humanity, we do more than respond to crisis. We prevent them, we reduce suffering, and we build a nation that is stronger, more compassionate, and more resilient. Long live Ghana Red Cross. Long live Ghana. Thank you very much.